Bismillahirrahmanirrahim. Dear student, welcome. I'm Fawad Ali, Assistant Professor, Department of Pharmacy, Port University of Science and Technology. Welcome to the course of Pharmacology and Therapeutics. Today we will discuss about the antibiotic class, the remaining part of the antibiotic class, like aminoglycoside. This is the second part. Okay. In today's lecture, we will discuss the following contents one by one, like the adverse effect and toxicities of aminoglycoside, the drug interactions of aminoglycoside, and clinical uses of aminoglycosides. Okay, what will be the lecture outcomes? After watching and listening this video, the student will know about the aminoglycoside adverse effects, its interactions, and clinical use, which is based upon its spectrum. Adverse effects. Adverse effects are basically the unwanted effects. So the toxicity of the aminoglycoside is dependent, like it is concentration dependent. Increasing the concentration, the toxicity is directly proportional to the concentration. Second thing which increases the toxicity of the aminoglycoside is the time dependent. The time of the therapy, if the time of the therapy of the aminoglycoside increases, toxicity will be increased. Risk and precipitating factors of aminoglycosides, like if we treat the patient, if the treatment exceeding than 5 days, and specifically using aminoglycoside in elderly patient, pre-existing renal disease, because it causes renal disease. So if the pre-existing renal increases, it enhances the renal problem, renal toxicity. High plasma concentration, then the concentration of the plasma. If the aminoglycoside concentration is increased in the plasma, when used with the loop diuretics, because it causes ototoxicity, and loop diuretic also causes ototoxicity. When used with other nephrotic drugs, because it causes nephrotoxicity. So when using with other nephrotoxic drugs like vancomycin, amphotericin B, and some other penicillin and cephalosporins, etc. Okay. First adverse effect is the ototoxicity. It is usually irreversible. Increased by other ototoxic drugs like loop diuretics and renal diseases. Ototoxicity includes auditory, it is cochlear damage, like it is mainly manifested by the auditory damage is mainly manifested by the tinnitus, like if a person feels ringing like bell in his ear. If the frequency of this ringing like bell increases, it causes deafness. Deafness started from the higher frequency sound. These tinnitus ringing like if the ringing like bell like sound frequency is increased, it causes deafness. Accumulate in endolimbs and perilimbs and causes damage to the hair cells in the organ of Corti. Neomycin, kanamycin, amikacin, and paromycin are most cholicotoxic drugs. Vestibular. It also causes vestibular damage like vertigo, ataxia, dizziness, loss of balance. So most commonly drug include which are vestibular toxic are streptomycin and gentamicin are the drugs which are most vestibular toxic drugs. Nephrotoxic. Nephrotoxicity is considered nephrotoxicity causes nephrotoxicity. Aminoglycoside causes nephrotoxicity. Like it considered in the renal cortex. Renal damage progresses to the acute tubular necrosis, often reversible but may become irreversible. It is reversible but may become irreversible. Manifested by the decreased creatinine clearance and increased serum creatinine level. So the RFTs, renal function tests will show there is abnormal, there is some impairment. So normally aminoglycoside. That's why the if the previously existing, if some patient have some abnormality like renal compromise patient, or previously some renal abnormalities, aminoglycoside are mostly contraindicated, specifically in this case, which increases the troughs of aminoglycosides, potentiated, precipitated by other nephrotoxic drugs. Obviously, if you use other nephrotoxic drug with the aminoglycoside, it increases the risk factors, potentiate the fact. Neomycin, tobramycin, gentamicin, nephrotoxic. Neuromuscular blockage. Aminoglycoside also causes neuromuscular blockage. Acetylcholine, like for example, it decreases acetylcholine release. Aminoglycoside normally decreases the acetylcholine release, which result in the postsynaptic response to the acetylcholine also decreases. So the myasthenia gravis patient are at more risk because they have in myasthenia gravis patient the amount of aminoglycoside at neuromuscular junction is decreased. That's why the myasthenia, if the patient having myasthenia gravis and we use aminoglycoside, so they are at more risk. Reversed by the calcium gluconate or neostigmine. Acetylcholine stays in the inhibitor, which increases acetylcholine amount. So they are normally reversed. This condition is normally reversed by the neostigmine or calcium gluconate. May lead to respiratory paralysis. It causes respiratory paralysis, but may need respiratory support. Hypersensitivity reaction. Dermatitis. It also causes the hypersensitivity reaction like dermatitis. Person handling the drug. Like they're mostly prone to the like if a person working in industry or mostly handling these drugs, they are mostly the dermatitis is the main hypersensitivity reaction in these type of the patient in the persons. Most common with the neomycin. Neomycin have mostly causes dermatitis. Caution. Precautionary measures while using amino glycoside, like regular serum concentration of amino glycoside should be monitored. Particularly, trough concentration should be less than 1 to 2 microgram per ml. So the regular serum concentration of amino glycoside should be monitored because high plasma concentration lead toward the toxicities. Serum creatinine should be measured in order to check whether it causes nephrotoxicity or not. So serum creatinine should be monitored in order to check the normal renal that the normally the function of the renal of the kidney. Drug interaction. Normally aminoglycoside causes nephrotoxicity, so contraindicated with other drugs causing nephrotoxicity like mostly vancomycin and etc. Autotoxicity, mostly the drug like for example these drugs are like loop diuretics etc. They cause autotoxicity. So aminoglycoside also contraindicated. Curare type of muscle relaxants like mostly like parasympathetic drugs, they are muscle relaxant. So they also muscle relaxant because it increases the amount of acetylcholine, especially in the neuromuscular junction. So contraindication, renal insufficiency. If the patient has renal insufficiency, amino chloride contraindicated. Pregnancy because it causes deafness in the child, and also in the myasthenia gravis patient. Clinical uses of aminoglycoside, like streptomycin, it is used in the tuberculosis. Like first line drug streptomycin is a first line drug in tuberculosis. 0.5 to 1 gram per day IM OD is normally prescribed. In children, 7.5 to 15 milligram per day. Plague tuberculosis is 1 gram per day is prescribed normally in children. 15 milligram per kg per day. But gentamicin is more effective in this case, like plaque and brucellosis, etc. Gentamicin. A severe infection like pneumonia, sepsis caused by Pseudomonas, Enterobacter, Proteus, Serratia, Klebsiella, and other gram-negative bacteria resistant to other antibiotics in combination with the beta-lactam ring. So, in severe infection, pneumonia, sepsis caused by Pseudomonas, Enterobacter, Proteus, Serratia, and other gram-negative resistant to other antibiotic in combination with beta-lactam ring. Gentamicin with other beta-lactam rings are normally prescribed. Enterococcal infection, nocarditis resistant streptococcal infection in combination with penicillin G or vancomycin, like gentamicin and penicillin G or vancomycins are normally used in combination, specifically in the endocarditis or resistant streptococcal infection. Brucellosis, gentamicin alone in combination with doxycycline is effective in brucellosis. Pseudomonas and Klebsiella infection of respiratory and UTI, gentamicin plus pipramycin or ticarcillins are normally prescribed in specific in the respiratory and UTI infection caused by the Klebsiella and Pseudomonas. 5 to 6 milligram kg per day IM or IV in a single or divided dose is normally prescribed. Local or topical uses of gentamicin: ointment, creams, lotions. For example, 0.1 to 0.3% gentamicin sulfate. Used in infected wounds, skin lesions, burns, prevention of IV catheter infections. Normally, gentamicin ointment or creams and lotion are normally prescribed in case of these burns, wounds, or catheter infections. Ocular and ear infection, normally 10 milligram, uh, may be injected subcutaneously or for intraocular infection. Normally, gentamicins are used. This is some conjunctival. Tobramycin more effective against the Pseudomonas infection. Pseudomonas infection, lower respiratory tract, complicating cystic fibrosis. Inhalation, like mostly used. Also used for other Pseudomonas infection, like given IM, IV, or in given IM or IV in divided in two doses. Dose 5 to 6, 7 milligram per kg per day, given in two doses BD. Kanamycin is oral, used as a gut sterilization. Parental gram-negative infection, gram-negative bacteremia, Pseudomonas infection, 15 milligram per kg per day. Amikacin, semi-synthetic derivative of kanamycin, it is less toxic. Less chance of resistance being a poor substrate for an activating enzyme like other aminoglycoside. Active against the organism resistant to gentamicin and tobramycin. Multi-drug resistance and kanamycin resistant strains of the Mycobacterium tuberculosis are susceptible to the amikacin. Natilmycin, it is an active organism resistant to the gentamicin and tobramycin, usually reserved for severe infection caused by the microorganism resistant to the other microorganisms. It is reserved for the severe infection which are mostly resistant to the mycoglycoside. Natilmycin is effective in that case. So 5 to 7 milligram per day per kg per day. Neomycin, not used systemically because of severe nephrotoxicity. It is used in the superficial wounds, or gut sterilization for the surgeries. Paromycin, intestinal, used in intestinal MBBSs. The spectinomycin, it is aminoxylitol, like the amino sugar and glycosidic bond, Used in gonorrhea resistant to the penicillins or penicillin sensitive patient. Single dose of the 40 milligram per kg up to 2 kg per day IM are normally prescribed. Uh, Adverse effect: it has pain at the site of injection. And, occasionally fear, nauseating fever, nausea like fever. Rarely anemia and nephrotoxicity. Expectinomycin rarely causes nephrotoxicity as compared to the aminoglycoside. References: